This.
Set.
How would I know that this is a sack foot?
Solid ankle.
How would I know that? I would have to try it out, right?
Dorsiflexes.
So when I hit heel strike, I get excessive dorsiflexion. Okay? So if you get this on the practical and you're not sure what it is, that's the only way to know. Okay?
At least I got one right.
What foot is on this leg?
I don't know. Push it. Ooh. Single axis.
Single axis. Okay, again, if you see this on the practical, the only way you're going to know that is to drive the heel into the ground and see what happens at heel strike. Okay? Do either a sack foot or a single axis foot provide any energy return?
No.
Okay. What foot does provide energy return?
Elastic heel and flexor.
An elastic heel does provide some energy return, and a dynamic response foot. Okay? What kind of foot is this?
The running foot.
Heel.
It's the dynamic response. Okay. You'll know that because it has flex foot written on it, and the flex foot is a brand name for a dynamic response foot. Okay. At heel strike, you're not really seeing plantar flexion. You're not really seeing dorsiflexion. And then in a closed chain, when you get off the toe, there should be some closed chain dorsiflexion. What type of suspension is this? It's a traditional suction suspension. How do I know that?
Because it's on top of it.
Well, you have an outside liner that's
Over top of the
sealing in the leg. The top of the outside of the liner has to contact what?
2 inches of skin.
1 to 2 inches of skin. All right. This type of suspension, is it appropriate for a transfemoral amputee?
No.
No. What type of socket is this? It's a patella tendon bearing or a total contact. Generally, if you said patella tendon bearing, I wouldn't say you were wrong. In reality, there's really no true patella tendon bearing socket because you're getting pressure in different areas. So generally, they're all total contact. What is this?
A liner.
Is it a silicone or a gel liner?
Silicone.
That's silicone.
Okay. I can tell that because when I squeeze it, it's not really giving way at all. Okay. You guys can pass this around if you want. And show me. All right. What kind of liner is this?
Gel.
This is gel. One of the easiest ways to know that is the name on it.
Thank you very much.
The alpha liners are, where they're not the only gel liners out there, are the most commonly seen. One of the interesting things about the alpha liner is the thickness. So you have a thicker area on the front for more padding, more wound prevention, more pressure relief. And on the back, it's thinner so that someone isn't limited with knee flexion as much. You can pass this around. Another way you can tell if it's gel is when you squeeze it versus a silicone, is that it's it'll actually give in more. The silicone is not as pliable, the gel is more. What type of suspension is this?
Pin.
Okay. Is the pin suspension appropriate for a transtibial and a transfemoral?
Yeah.
Okay. What's it more successful on?
Shorter.
Transtibial, yes. What would be one thing that would be an advantage of a pin suspension? It could have an audible click. It can be easier to don for someone with transtibial. What's the limitation of a pin suspension?
Pressure in one point.
Spin.
Pressure in one
It can
spot.
spin. Pressure's at one focal spot. False sense of security, that's correct. What suspension is this?
Lanyard.
Okay, is this appropriate for transfemoral and transtibial?
Yes.
No, just
No,
transfemoral.
just
Transfemoral.
Okay, you're not going to have the broom on the socket to get the lanyard to attach on the outside of the transtibial. Alright. Alright, what type of suspension is this? Appropriate for transtibial and transfemoral? Okay. Is it adaptable? No, not compared to a traditional suction or a pin. What happens when you add 5 or 6 ply of sock? You start to lose suction. So early on in the prosthetic fitting process, you might not use this suspension. You might use a different suspension that you could adapt to the changes in size that your patient's legs will have. Okay?
So that's used like later on?
It can be used later on, or if you have somebody that has a very mature limb,
Oh, okay.
meaning that they don't have a lot of edema in their limb, then we might throw it on more early on. Just keep this one back there in that section.
No.
You want to feel this?
What kind of socket is this?
That's a ischial containment.
Okay. What kind of knee?
Mechanical lock.
Yeah.
Manual locking knee. How do I know that?
It's got a
It's got a
little
cable.
manual lock.
What's been done to this socket to relieve pressure?
Windows.
Good. What's this part called? Flexible inner socket. Okay. And what does that allow the patient to do?
To increase
Increase
comfort
proprioception, increase comfort.
and make it lighter.
They were able to make it lighter by windowing the socket.
Better muscle contraction. You can.
Yeah, because you have more pressure, better proprioception does lead to better muscular contraction. Alright. What kind of gait deviations might you see with a leg like this?
For the manual one?
Circumduction would be one.
Hip
hiking would be another. And what's the third? Vaulting. Okay. What kind of suspension is this? It's the femoral cuff. And then if I tag just this, what's this the bottom portion of? Sleeve belt.
Sleeve belt.
Okay. What would be a better option versus this type of suspension that you now have available? Right. Okay, for transtibial, what would be a better type of suspension versus the femoral cuff and the sleeve belt? Somebody say traditional section.
Traditional
That would be
section.
one. What would be another one?
Sealing.
A sealant would be another one. Ischial containment type of socket. What would be a third type of suspension that would be better than a femoral cuff? A pin. So pretty much anything's better than that.